Years after the CDC released guidelines aimed at stopping the overprescription of opioid painkillers, patients who need those medications to ease chronic pain have been left suffering, some to the point of suicide.
Yeah, chronic pain impacts 20 to 30% of the population and 60 to 70% of people over the age of 65. Our political specialist Sean Boyd joins us now with a bill aimed at helping those individuals. And Sean, for them, opioids are life-saving.
Yeah, we're talking about people who live with never-ending pain. The CDC guidelines were catastrophic for many of them, as insurers denied reimbursement, pharmacies set strict limits, and doctors began turning those with chronic pain away or rapidly tapering them off, the only drug that gave them relief. Now a state lawmaker is stepping in to help.
It feels as if somebody puts a knife into my low back.
Diagnosed with degenerative disc disease, osteoarthritis, and scoliosis, Christina Johnson has lived with chronic pain for nearly 50 years. Morphine, she says, the only thing that eased the unrelenting pain. But when the CDC came out with guidelines in 2016 with strict limits on opioid prescriptions, her doctor abruptly tapered her medication.
I was much more functional than what I can do right now.
The body can't take that kind of pain ongoing.
Julie Riskin with the Colorado Cross Disability Coalition says many doctors are refusing to treat patients on opioids altogether, leading some to turn to the black market.
We've seen a lot of our members who were stable, who were working, who were contributing, who were part of society, they're now lying in bed. We've lost people to suicide because they couldn't get their pain treated, including a 17-year-old volunteer with us.
We've done a great job at reducing opioid addiction, but we need to pay attention to those people who need opioids in order to just live a normal life.
For more than a year, Senator Joanne Ginal has worked with doctors, pharmacists, and patient advocates to draft a bill that protects providers who prescribe high-dose opioids from disciplinary action, prevents them from denying treatment based on a prescription, and prohibits them from forcibly tapering a prescription.
We have people that have been, at home for years and years on end because they can't get treated. And it just has to stop.
Responsible use allows me to be here and to continue to participate in life.
The CDC recently issued new guidelines that still recommend non-opioid pain management when possible, but also acknowledge that physicians should decide what's best for their patients. Senator Ginal's bill does not mandate providers prescribe high-dose opioids, but rather protects those who decide it is the best course of treatment for their patients. The bill got its first hearing today, and it passed the Senate Health and Human Services Committee unanimously.
Yeah, certainly a different side to this.
Yeah.
Yeah, Sean, thank you.